Welcome to Connective Care Education. In this video, we are going to look at the content for Unit 003, Learning Outcome 7, Administering Medication. Legislation and national guidance related to the administration of medication. Legislation and national guidelines are in place to ensure that medications are safely administered. These include the Social Services and Wellbeing Wales Act 2014, the Misuse of Drugs Act 1971, Regulations 1972 and 2001, the Health Act 2006, Controlled Medication, the Control of Substances Hazardous to Health, COSH 1999, Hazardous Waste Regulations 2005, Mental Health Act 2007, Mental Capacity Act 2005 and Associated Code of Practice, and All Wales Guidance for Health Boards and Trusts in respect of medicines and healthcare support workers, November 2015. Roles and responsibilities of those involved in prescribing, dispensing and supporting the use of medication. Policies and procedures in settings related to medication are put in place to ensure that legislation is being followed so that both practitioners and those being cared for are safe. Policies will outline the roles of different individuals in the administration of medication within organisations. It is the role of the doctor to prescribe medication indicating the dose, type and amount of medication to be given. The doctor should explain what the medication is for and any side effects that might be experienced. It is the chemist's or pharmacist's role to dispense the medication, checking that the medication dispensed matches the prescription. The medication should be labelled with details such as the name of the individual who is to take the medication, the name of the medication, the date it is supplied and the expiry date, the dose to be taken, how it is to be taken, for example, orally or intravenously, and how often. Any special instructions, for example, eat before or after food, should all be recorded. In the case of over-the-counter medicines, the pharmacist has a responsibility to make sure that the medicine is suitable for the individual and the medical condition they want it for. The risks associated with administering non-prescribed medication occur when there is not sufficient knowledge about potential interactions with other medication already taken. In a social care setting, the manager should ensure that policies and procedures are in place that meet regulatory requirements and that staff have regularly updated training on the administration of medication. They should ensure that care plans and record-keeping systems are in place. Before administering over-the-counter medicine, care workers should be familiar with organisational policy in relation to those medicines. Regulation 13 of the Health and Social Care Act 2008 regulated activities. Regulation 2010 states that the registered person must protect service users against the risks associated with the unsafe use and management of medicines by means of the making of appropriate arrangements for the obtaining, recording, handling, using, safekeeping, dispensing, safe administration and disposal of medicines used for the purposes of the regulated activity. In the case of over-the-counter medicines, the manager has a responsibility to confirm with the resident's general practitioner that they will not interact with prescribed medication. It is the carer's role to ensure that the patient gets their medication. They need to ensure they give the correct dose of the correct medication at the correct time. The respect and dignity of the individual should be maintained during the administration of medication. Records of administration of medication with date, time and dose should be kept. Carers should be aware that over-the-counter medicines shouldn't be taken with prescribed medicines unless a doctor or pharmacist has confirmed that it is safe. The links between misadministration of medication and safeguarding. Mistakes can be made at each stage of the medication process by the general practitioner, pharmacist, manager or carer. Many errors occur through procedures not being followed correctly. The misadministration of medication is considered to be a safeguarding issue when there are concerns that there has been medication withheld without a valid reason, incorrect use of medicine other than for the benefit of a resident or patient, deliberate act of harm using medication, accidental harm caused by an administration of medication error, deliberate falsification of records relating to the administration of medication, and the misuse or over-reliance on sedatives to control behaviour. Staff in social care settings should be aware that concerns regarding the administration of medication should be reported under safeguarding procedures. Please pause the presentation here and complete worksheet for Unit 003, Learning Outcome 7, Worksheet 1 and Unit 003, Learning Outcome 7, Worksheet 2. Please submit completed worksheets to your assessor and move on to video for Unit 003, Learning Outcome 8, Falls. Thank you for watching.